Mindfulness is a term that relates to having awareness of the present moment and also an acceptance and compassion towards your self and others. Mindfulness is practiced in a lot of treatment programs. To date, there haven't been a lot of studies. There have been about 8 studies showing the effectiveness of mindfulness for eating disorders. However, from the sort of common sense point of view of clinicians, they see the value of mindfulness in mindful eating, in mindful physical activity, so just being more present with and slowing down your eating and more attentive to your sensations, your thoughts that come up from eating. And because everyone knows that eating less and better food and exercising, more physical activity is good, but we don't always do that. And so mindfulness has been a strategy that can be helpful. Mindfulness has been used in overeating programs. It's less usual that a physician would be trained in that or a nurse. Typically it's a counselor or someone who's had formal training in mindfulness-based stress reduction at UMass or at other places using that model or other models. However, physicians and specialists in this area are more and more having this be part of both their own personal lives as well as being able to bring it into their clinical work. The nice thing about bringing mindfulness into your life or work is that it's not an extra task. It's really paying attention to what you're actually doing now. It's so easy in our mindless society with all the different triggers and email and cell phones and too many activities to really not be attentive to the moment. There are many different ways in which somebody could learn to do mindfulness for their own personal life or even for being trained. There are programs like our Center for Mindfulness at UMass that have an 8-week program, 2 hours a week, and then a weekend retreat where there's a focus on having some quiet time to really practice the skills. A program like that can be in the $300 to $500 range for the whole program. In different communities, they'll have programs like that. So if someone put in their search engine mindfulness-based stress reduction, they would find a lot of treatment or educational program options. If one wanted to become a therapist in MBSR or other models, there often is a training program, just like at UMass. If you finish the core program, and we always recommend people do it for themselves first, and then they can learn how to be teachers of it. There are spin-offs of mindfulness-based activities like mindfulness-based cognitive therapy for depression, and that's a similar model that we're using for eating disorders, overeating. There's M.P.H, mindfulness-based eating disorder program out of the University of Illinois. The Wellspring model appears to be a terrific model, and there was some discussion about using mindfulness. There have been specific mindfulness-based programs adapted for adolescents because they are different than adults and how they respond to it. But it can be very effective. The MBSR model has been modified for adolescents. It would probably be more intensive with what Wellspring does, but I think they really have an opportunity with people being there to do a lot more. We've integrated mindfulness into a lot of our adolescent programs, and they have responded well to that and really look forward to it.